Specialties for nurses, which are not for just any nurse, so I'm going to talk about specialties here that might not be for you. You have to be very realistic about your professional situation so you can understand whether it was for you or not. By the way, don't forget to like, share, and subscribe. That way, you help us stay up to date and alert, and you won't get caught in the traps that are out there in the educational field. All right, let's go. First, the classic question, occupational nursing is good, it's excellent, it's not difficult when we talk about occupational nursing. But why isn't it for everyone? Many people want to go into occupational nursing without knowing what it involves. The first step to becoming an occupational nurse is making it your career and life goal. I'm overwhelmed by bedside care, so I'll go into occupational nursing. First of all, do you really know what an occupational nurse does? Do you know what the possibilities are? Because the vast majority of people I know who have a post-grad degree or who want to go into occupational nursing are thinking about being a nurse in a hospital, a clinic, or a big company. And that's where a big mistake begins. The first thing you need to understand is that occupational nursing has many possibilities beyond those. Now you need to understand what your true calling is to become an occupational nurse. First, you are going to promote workers' health. So preventing accidents is promoting health. It's analyzing the health of the employees of a certain company. It's providing training to reduce the chances of mistakes. It's about collaborating with the Internal Commission for Accident Prevention and understanding programs like environmental risk prevention, occupational health medical control, regulatory standard 17 and more. These must be part of your DNA. I want this, I like to prevent, you know? So occupational nursing is about preventing problems, not fixing a problem. Not thinking that I have to study just because someone hurt their hand or because someone got burned in the factory. No. The main idea of the occupational nurse is to prevent accidents, to promote that together with the team. So, first point, if you want this, you need to understand that this is the world. The world is about prevention and promotion of workers' health, accident prevention, and ultimately health promotion. That's where failure comes in. When an accident happens, there was a failure, either on the part of the employee or the institution. And at that emergency moment, we provide emergency care and refer the patient to the hospital. So, a lot of people are mistaken, thinking that an occupational nurse is someone who deals with accidents almost every day. Anyway, no, for God's sake, that's not supposed to happen. So, your job is almost like primary care within a company, just so you understand. So, if that's what you want, fine, but it's not for everyone. Not everyone has that profile, okay? Perfusionist. First of all, being a perfusionist is a field that's hard to get into. Hard in the sense of doing a specialization. I either don't recommend it. I recommend that you do a residency in perfusion. The question is, looking at Brazil as a whole, where can you find perfusion programs to do? Whether you're a physical therapist, nurse, biomedical scientist, doctor, any of these can do perfusion. So first, don't do a specialization in perfusion. Rule number 1. Why, man? You need to have contact with patients in large-scale surgeries, major surgeries that require perfusion. The theory is going to be excellent, but the practice is fundamental. Man, do you think a cardiac surgeon who studied for I don't know how many years to be the guy in cardiac surgery is going to trust you? Who did a 360, 400-hour specialization without actually being there? But it's not the specialization. The specialization isn't the problem. The problem is, do you really master physiology from end to end? Are you the guy in biochemistry? Do you really understand hemodynamics for real? What is oxygen delivery? 2, what is cardiac output? What is venous saturation? That's the minimum. So that's something that's already ingrained in you. Perfusion isn't for just anyone. Perfusion, you have to really chew on it, really chew on physiology, biochemistry, pharmacology, and a lot more. Why? Because your job is that the heart has stopped, and you are going to do the heart's work using a machine called the heart-lung machine. And then, man, you have to control the temperature and electrolytes in real time. The surgeon won't help you because he's doing his own job. So, the perfusionist has to be someone who knows a lot about hemodynamics and its physiology. If you had difficulty, Either you study before you get into perfusion, because otherwise you'll get frustrated with perfusion. Man, before you operate a cardiopulmonary bypass before you go, man, you have to master hemodynamics a lot, and it's in real-time hemodynamics, real-time correction. So if you have difficulties with biochemistry, with chemistry, with this part of cell biology, maybe it's not for you. So don't go just because maybe it's an area that's lacking professionals or something like that. Go because you really like this area and it's an area that's going to be really good for you. Third, this one is a big one, huh? Gynecology and obstetrics, guys. Here's the thing. It's cool, but you have to understand if it's for you. First point, what is the job market like? For GAU, you already have to think about what kind of job market you want for gynecology and obstetrics. First, primary care, where we mainly work with prenatal care. So if you want to work in primary care, that's cool. Second, working in a specialized health center, not just for women's health, but also for pregnant women, maternity or something like that. But your role is to set up your own business, Let's say that's what I would do if I did GAU, set up my own business. But what kind of business? Doing prenatal care and natural childbirth. In other words, if I were a GAU, I would think from that perspective. Because it's not for everyone, because people want this at any cost, man. You have to like birth. You have to like the process of growth and development of the fetus, which is forming there in the mother's belly. So you have to like this, you have to be willing to do it. So this can't be done just because, oh, it's cool, it's trendy. No, it's not a trend, man. You have to like it. To provide good care for the health of the pregnant woman and the baby who is going to be born, you have to have control over emergency situations that may happen. When assisting a natural childbirth, complications may arise, so you must know how to manage them. So, my recommendation is to do a residency where you'll spend 2 years handling all kinds of deliveries, gaining a lot of experience, and then either start your own business or work for the government, okay? If you don't have a career plan, you might get frustrated, especially when doing a residency. I really don't recommend it. A specialization in gynecology and obstetrics where you won't be able to meet the minimum requirement for deliveries. You won't be able to register your specialization with the COREM since a minimum number of deliveries and prenatal appointments are required. And another thing is that you'll be an insecure person. And I agree with your insecurity. You didn't have much experience, so experience is very important for this type of specialization. I'm not sure if this video turned out well or if you liked it, but I'm being honest, just being real. I understood what you said. Ader, I understand, I get these points, and these points aren't a problem for me, so it's for you, Ader, I understand these points. If you have difficulty, then study. You can't just think you'll get by with difficulty without studying. To be a good professional, a specialist in that area, no, there's no other way. Either you're good or you're good. The specialty doesn't accept average professionals. Many perfusionists, occupational nurses, and obstetrician GYNs are frustrated and unemployed. Why? Are there good professionals and then the rest? Who do you want to be then? That's what defines your future, so your future depends on you.